Good morning and welcome everyone to today's session of our survivorship series, Survivorship Social Work and Nurse Navigation FAQ session, led by Kara Morales, Carrie Riding, and Alicia Morgans. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the survivorship team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center, as well as the survivorship website. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Alicia.
Great, thank you so much. And we're really excited to be here and always excited to engage in the Blum webinar series. I want to just give a special shout out to Lauren Nelson, who has been coordinating this collaboration since the pandemic and probably even before. So a long time, and all of these webinars are actually living as options for you to review in the future on our survivorship website, and Lauren also manages that. So please take a moment to check that out and look at past webinars and be on the lookout for future ones if you are interested. So today, I am so excited to be talking to Karen Morales and Carrie Riding, who are two of our survivorship team members. Karen is our survivorship social worker, as well as our tobacco cessation counselor. And Carrie is our oncology nurse navigator for survivorship, an extremely invaluable contributor who is sort of the glue that holds all of our many pieces of survivorship together. And in many ways, I think Karen does the same. So thank you both so much for being here with me.
Thank you.
Thank you. All right, great, guys. So let's start with just trying to understand what your roles are. I think when people are referred to survivorship, they don't always know who all of the different members are, especially if they're just not necessarily as familiar with the way that healthcare systems work, and that's most people probably. So we'll start with Karen. Karen, you're a survivorship social worker, and so can you tell us a little bit about what that is for a survivorship patient population?
Definitely. And first and foremost, good morning, everyone. And thank you so much for joining us this morning in my role, which I absolutely love. What I really do is, I provide support to patients who are receiving, active survivorship care within our adult survivorship program. And I provide a service that includes short-term counseling for issues such as the stress in response to that transition out of active treatment, right? Like, what does that look like? Where do I go from here, right? How is my life looking like after treatment? How do I navigate those different, systems in my life, whether it's work, school, just family in general as well, emotional challenges related to the cancer diagnosis, and really also looking at how side effects can impact a person's overall well-being, whether it's, late-term effects of treatment, how people are coping with that, and really also just finding that supportive resources in local communities. We work with patients across the United States, across the world, and sometimes, they need a little bit extra support finding resource within their communities. So I really do try to help them navigate these resources and connect them to these local resources.
Great.
So that's the gist.
Yes, not a small set of tasks. So, so thank you for that. And Carrie, you're an oncology nurse navigator. Many people in the survivorship program may have had experiences with our ONN team members when they were in their disease centers and when they might have been getting treatments or even follow-up. And, these are often the folks who call them on the phone between visits or make sure that everything is running smoothly. How does your role differ from that? How is it the same? What is an oncology nurse navigator in the survivorship setting?
Thank you, Alicia. It is great to be here. The oncology nurse navigator role, can be defined differently in different arenas. But in survivorship, what I'm finding is that I kind of am the person that is often like the first clinical person to talk to someone, people who call to have questions or are referring for different reasons, I kind of am that first touch point where I explore what's going on with them. What are their challenges? Do we need to set them up in our regular clinic where they're just being followed by a provider on a yearly basis for that yearly like surveillance and overall health evaluation? Or do they need some of our special needs? And I have such a holistic approach to nursing that my whole goal is when I'm speaking to someone is to look at all of them. And I just listen carefully. And a lot of people are calling with a variety of different questions, things like integrative care ideas and not really knowing where to find help, medical clinical questions, and really trying to understand, do they need survivorship or they need to go back to their medical oncologist, financial issues, billing issues. I mean, the list kind of just goes on. And I have a lot of experience in oncology, so I generally can really understand where people come from, but also am trying to help them navigate moving forward. And we have so many resources that I feel like the holistic approach really works. I mean, we get so focused in medicine, this is medicine in general, around, taking care of the body, taking care of the cancer, but the after effect, really, it all impacts the like mind, body, heart, spirit, right? So I can engage in those conversations and give people presence and then referrals and ideas on what might best meet their needs within our program and beyond.
Great. And that's why you're that glue. You're really kind of just tentacles everywhere, trying to connect our patients with the resources that they may or may not know are out there. And I think that's one of the challenges in our survivorship program is ensuring that patients know the myriad resources that are actually out there. These can be explored on our survivorship website, and we'll try to maybe put that information out there for the folks on this webinar so that you can engage there. But certainly if you come in and see one of our nurse practitioners or see or talk to Carrie on the phone, our ONN, you can be connected to these clinicians as well. Karen, as Carrie mentioned, this is often a population that is transitioning in so many ways. And the transition from being actively followed in your oncology clinic to being followed maybe in a survivorship setting because you've kind of moved out of that intensive follow-up period and now are hopefully kind of returning to normal life. That transition can be really, really hard because an intense situation. And how do you go back to normal? What are some of the things that you end up talking with our survivors about? What is the most common reason that you engage with our survivors as a social worker in this transition?
Yeah, so like Carrie said, that holistic approach, that's something where I think in social work across Dana-Farber is, we are very patient-centered. We're very holistic, really trying to navigate, the different aspects of life, right? So when I meet with patients, in this survivorship phase, my really main goal is really looking at, all right, how do we navigate? What does that look like? What does that even mean for a person? What does transition mean for the person, right? And I'm very much the person that, whether it's 1 year out of treatment, whether it's 5 years out, post-treatment, lives are different, right? Circumstances are different. The experience is so unique and should be dealt according to the person, right? Meeting them where they're at and really saying, all right, did you struggle having to be at Dana-Farber 3 times a week or 7 days a week? Right. And what I like to do is really sit down and take that time to reflect and say, all right, how did it feel? Honestly speaking, how did it feel, having to come in multiple times a week, having, doctors saying, oh, I think this is what's best for you, hearing nurses, oh, you should do this, this may be helpful. And how do you now, after all of this, live your life with no one really telling you what to do anymore, right? Or how does it look like not having to come to the Farber as often as you did before? Right? How does it look like dealing with maybe other illnesses that have arise, post treatment? Or, what does it look like taking care of family members now who used to take care of you while you were in treatment? So what I like to do is really approach, patients with that understanding of it's okay to not be okay. It's okay to feel maybe a little overwhelmed, feeling like, oh, I don't even know where to start. And what I like to do is approach that person as a whole and say, well, how do you feel about it? Even if you don't know, right? Let's talk about it. Let's talk about how, this challenging. Is this a little like, oh, this is surreal for me? So I really want to focus and try my best to ensure that patients are having a space where it's safe, where they're able to come as themselves with any questions, concerns, frustrations. And I strongly advocate for any patients that I meet with, to take that time to really be selfish and say, I didn't like this, or, this really changed me in ways that I didn't imagine. And then we work from there, right? Because it's so important to meet our patients where they're at and really just then help them navigate from that point forward.
Wonderful, wonderful. And Karen, I just wonder, ¿puedes hablar español con?
Yes. So I actually, I think it's amazing that I'm able to work with our patients who are Spanish speaking. I am a qualified bilingual staff. So if there are patients here who speak Spanish, please definitely send them my way. I'm more than able to speak with them in, the language that they know best. And I also just want to say we do have obviously translators as well. So if you have a patient who speaks another language or dominates another language, please don't be afraid to send them our way. We will still work with them, and we have an amazing team in interpreter services as well. Just want to throw that out there.
Wonderful, wonderful. And I think, as we're trying to get through a really confusing time, being able to speak with those patients in a language where they feel more comfortable or may have better words for the things that they're trying to express is so valuable. So we're just very grateful for your expertise in that area as well. Carrie, I think sometimes I think of you as a bit of a problem solver. So when patients are not exactly sure what they need, how they need it, you are there to try to connect the dots. Can you give an example of, some of the calls that you might take on a daily basis, or some of the most common things that you hear from patients, and how you help them kind of get from point confusion to point purpose?
Sure. I think one of the challenges is, the definition of survivorship really starts like the day you're diagnosed, right? And our program is sort of designed to really focus on people in different places. So what I often do is meet people, they call with questions, whether they want to become a patient or they've got some symptoms that they need taken care of, or their provider has reached out to us and said, we've got these problems, can you help? And my goal every time I speak with someone is to just really understand where they're at, what their pain points are, and to describe whether or not survivorship, our program and our clinic can meet them where they're at, or if they actually need to be kind of moved in a different direction. I call it like managing the gap. Like there's a lot of different ways that we can help, but it really is an exploration with each person. And so for an example, a patient of ours reached out who was looking for some interest on like rediscovering what wellness feels like. And she lived out of state, quite far away, actually, comes up for treatment from past Washington, DC. So not easy to access our services and is still on treatment. So really exploring with her, like what she has around her, what she can do. And she had some things already there, but there's also some support groups here that she would be eligible for. So I gave her that information because those are on Zoom and she would be able to access those. Initially, I have to really figure out like where people are at and where we can best serve them. That's like probably the most common thing. And then I'm also really very much here for everybody on our team. So just helping things continue to move. Like we have different specialists, in cardiology, nephrology, endocrinology, like making sure that those referrals are all going smoothly. And also connecting with patients, because sometimes we get referrals and I'm reading about a patient and they come from, 2 hours away, and coming here for that extra appointment may be too much. So really connecting, like, is this going to work for you? Or do we need to do this virtually? Or is there a local person that might be able to help with this that can loop back in with us? It's really trying to figure out, when you've got someone who's still undergoing treatment and using some of our services, I'm really trying to keep that the understanding in mind of what they already have on their plate. And then people who are not undergoing treatment, like, what are the services that we have really are very, what's the word? We have so many resources. And I think that helping people like break down what they need, kind of like what Karen was saying, what is it that we can start with? And then you can build from there.
Great. And thank you so much for emphasizing, as we always do in the survivorship program, that you're a survivor from the moment of diagnosis. You are living with the cancer diagnosis. And so things are different. And not everyone likes the survivor name or label. And so you don't have to use that if that's not, doesn't work for you. But our program is there for you in whatever way we can best be helpful. And sometimes there's an interesting difficulty, not difficulty, but it sometimes can be confusing. Understanding, should patients be getting some of this support within their disease center? Is it time for them to get certain supports through survivorship? And so Carrie is so helpful in sorting that out. And sometimes people are sent to resources in their disease center that the physician didn't even realize that this was the way to go. So really educating all of us and all of our doctors and nurses, nurse practitioners, PAs, and keeping us all glued together is such a wonderful aspect of what you do. Now, Karen, I would say in the last few years especially, challenges to mental health have been just increasing. Obviously, with the pandemic, we all, having cancer or not having cancer, had traumatic experiences, continue to have them in some situations. And I think that our cancer survivors who are now transitioning are also transitioning out of that traumatic event. And I think that there's definitely a lot of psychiatric distress. And so I know that you, as a social worker, often support patients as they're doing that, as going through those things. As you said, you really talk to them about reflecting on their feelings and understanding those. From a long-term care perspective, though, your role is really not to, continue to be a long-term psychologist for folks. You do provide those services in the short term, though. How do you help patients navigate that transition between kind of getting initial services, maybe to help them understand their feelings, and then transition to local psychology, so psychologists, psychiatrists, support in their area? How do you help that? Because we certainly can't manage the mental health needs of every survivor in the Boston area, let alone the entire Northeast, through you. So how do we help that? Because that is a huge issue.
It really is, and I thank you for acknowledging that. Right, it's been a really tough time for everyone, as providers as well. Right. And I think the best thing about this role is that because I do meet with patients short term, even though it's not long term, but you kind of get to know a patient in a sense, right? You're okay, like, oh, this patient may benefit from like maybe this type of additional support. And then from there, I think it's so important to be very upfront with patients. And that's what I do, when it comes to the support I provide, I let them know from the beginning, like, look, this is what to expect. These are, expectations, and this is what I can help you with. And then from there, I actually have conversations about what would therapy look like for you. Right? Because another thing about being patient-centered, we have to meet the patient where they're at. That's just, I think, a key principle in social work, right? And a patient has a right to self-determination. So the patient gets to decide what works for them, what may work best, what may not work. And I have those conversations. I sit down and say, all right, now that we're looking to transition, what would that look like for you? Do you want someone in person? Is there, a specific provider that you want that has worked with your belief, your specific religion? And from there, we work together in figuring that out. Like, okay, where do we go? Where can we go? Do you want someone local? Do you mind driving somewhere else? So it's very personalized. And I think it's so important that it continues to be personalized, because no two people obviously need the same support, right? Everyone has different needs and it varies. Another way that I help with assisting is also looking at what around you or like what resources can help assist with this. So sometimes referring back to the PCP, and maybe, you know, let's say if their primary care is at a specific hospital that's local, all right, what would it be like if you reached out to your PCP and asked them, okay, you know, do you have any resources? Are there even social workers within the network that can help me? Another one is, you know, obviously there's websites online that we can always refer, but also even calling your insurance, right? What does your insurance offer? Do they have a list of providers already, you know, created where you can just say, oh, do you have a list? And then from there you can call, right? You can kind of see, oh, this person may be a good fit for me, and then go from there.
Great. I think that that's definitely something that as a culture, I hope, and I feel like we're trying to acknowledge mental health and its importance more. But there are always challenges and barriers around that, and facilitating those connections for short-term care, then long-term care for our survivors is really, really, really important to us. You know, Carrie, I think, you know, one of the things that you do, as you mentioned, is you support our nurse practitioners and our PA in the work that they do, providing that ongoing survivorship care long-term. When patients have questions, they, you know, have a medical problem, maybe get the flu, whatever it is, you know, how do they best engage with those providers? Are those the right providers for them to engage with if they have acute colds or need blood pressure management? Or are these kinds of things that maybe they should be engaging with primary care? And how do you help when they send a message through Gateway and aren't really sure who to talk to? Because that happens too.
Yes, the people that are followed in our survivorship program for their maintenance care with the nurse practitioners and our PA, anything that you would call your oncologist for is what you would call these providers for. So yesterday I got a call from someone who was having some pain in the area of her surgery many years ago, new pain. And so I reached out to the nurse practitioner who follows her, and her appointment was supposed to be in 6 weeks. We moved it up so that it's happening in a few days, just so that she could have that evaluation by the nurse practitioner. And then the beauty of the survivorship program is that if there's anything that is up with that, our nurse practitioner loops in her medical team right away and gets things moving quickly. But if you have normal kind of like everyday kind of flu, you know, in the COVID season, we got lots of calls, any type of like, you know, symptoms that are really fall under the PCP umbrella, we typically are not the place to call, unless it's like a day before the appointment and you're not sure if you should come in. That's reasonable, but I will refer people back to their PCP. It can be challenging because not everybody has strong relationships with their PCP. So they'll sometimes want to call and kind of put everything under one bucket. But our expertise is being that person who takes the baton once you no longer need to be seeing your medical oncologist for your acute cancer care. And so we continue to provide that ongoing care. Number one, it really helps manage the anxiety that can come up when these issues come up, because I don't think that ever leaves someone once they've been diagnosed. And it provides a connector, like immediately, like if there's a question, even sometimes I'll be emailing the surgeon and the nurse practitioner at the same time, be like, this sounds like something, do you want to look at it or should we? So it's really about bringing the right people together to be with that person, really evaluate what's going on, and then look at next steps.
Great, thank you. So I love that rule of thumb that if this is something you would talk to your oncologist about, then it might be the right thing to send that message through the patient gateway, to reach out on the phone and ask about. And I would also say that if you're not sure, you can always reach out and ask us. We might just tell you, you know, this is something best to talk to a PCP about, or think about going to acute care for a COVID test or whatever it is. But it's interesting. I think certain oncologists help with different refills and different things over time, but they're probably not the people that are, for most of our patients, managing your cholesterol or managing blood pressure and things like that. Sometimes that happens because of the treatments that people are taking, but in those cases, probably you're still engaged with the disease center and you might still ask your oncologist. So for most people, primary care still needs to manage those kinds of general medical issues. But great answer, great rule of thumb, and thank you for that. We have a question coming in through chat, and please others, send additional questions through chat. This is the reason that we're doing this, is really to take your questions. So let me just read this out. This is, I think, a question for Carrie, but then I'll ask Karen to chime in too. So one of our attendees says, I went through treatment at the height of the pandemic, and I'm so grateful that you made it through, and thank you for trusting Dana Farber during that time. I find that communication, this person says, about available resources and services was not happening given the confusion of the pandemic. I'm just learning today that these survivorship resources exist. I'm 2 years out from treatment and I am still struggling. What is the first step to take to get help from this program? Carrie, I wonder, can you start us out? Let us know what should someone do? You know, they're just learning about survivorship at whatever point in their process they are. What can they do to really get engaged and to find out more?
What I would suggest, because you're 2 years out from the program, I would call, we have our phone number 617-632-4523. And I would call to actually ask to speak with me, because you are not at the time where we would transition you away from your medical oncologist, but that doesn't mean you're not having real struggles. And the thing about medical oncology is we're really good at like navigating the piece of the pie where it's like your cancer, getting you through treatment, getting you through the side effects, and then there's routine follow-up. But what I'm finding is that there's a lot that falls through the gap. That's what I mean about managing the gap. And just by having a conversation with me, I can kind of help assess what's going on with you, pretty much like Karen said, really meet you where you're at, and then let you know what some of the resources are within the program. And point you in the right directions, because you're in the middle. Like it's not that you don't need our survivorship resources, but you'll fall in line with some of them. And then some of the others will actually still remain with your original oncology team. And then there's also other things that I guide people to do in their community close to home. Like there's certain things that you can access around you that may help as well. But the best way to do it is to have these individual conversations.
Absolutely. And I've asked for someone to please place the web address for our website into the chat for everybody, so you'll be able to take a look there. You can explore the website as well. Thank you so much. Oh, that was a direct message to me. So one more time. Thank you. Thank you. Oh, that's to hosts and panelists. Maybe just to click on everyone, sorry. And thank you to Lauren, who is always updating this, and it'll be there in a moment. But this website actually has a list of all the different things that we're offering, whether it's around sexual health, whether it's around a specific medical condition like heart care or bone health or something else. You know, we have all of these things. And I think what's so important about the survivorship program, and thank you for posting our website, what's so important about our program is that we're there through the course of treatment for certain things and to help support you. And then we're also there in the long-term surviving after a cancer diagnosis setting. And there are just different ways that we can be accessed in those two different settings. And so that's why Carrie can be so helpful. Sometimes people will call in and they'll be still in their disease center and they'll have questions that can best be met by the social workers or the support teams in the disease center. Whereas other times they'll call in and they have questions about maybe fertility and pregnancy after cancer. And those questions can best be answered by some of our fertility docs and team members in survivorship. So Carrie can help you with sorting all that out. And we will make sure that you certainly have that website too, because there are a lot of things on the website that are sort of self-management materials, information about vaginal dryness, if you've had radiation to the pelvis for whatever the cancer was, and how you kind of deal with that and with your sexuality moving forward, or mental health specialists. And there are resources and ways to access different programs that are available in Massachusetts and New England, and lists to help you find somebody if you don't necessarily feel like you need to talk to one of our providers to get that information. So there's a lot of information there. As I said, the webinars from the past are in there. So much content for people to learn on their own, or else see how to best engage with us. And we can try to, again, meet them where they are. Now, Karen, same question for you. I'm just wondering, can you say if somebody isn't sure, they're struggling, they're kind of in this position, can you help those individuals if they're early on, or are you more for the later term, longer term? Is that more of a disease center, social work need? Where do you fit in?
So I fit in wherever I'm needed, honestly speaking, because the goal of survivorship, as I mentioned earlier, it doesn't matter if you're 1 year, 5 year, 10 year, it's your experience, right? And it's life-changing, right? And acknowledging that and recognizing that it may have been difficult. You may have not really processed within a year, 2 years out, but maybe 10 years, there's something coming up that you're like, wait a minute, like I'm being reminded of my treatment, and oh, wow, I have these feelings that are coming up. So, like I said, it is short term, but please don't be afraid of that idea of short term. No, I still want to meet with you. I still want to talk with you. I still want to help you navigate. Okay, well, why am I feeling this way? What's coming up for me? And then what can we do together? Or, okay, we met a few times. Now I need someone else for a little bit more longer term care. And that's what I want to do. I want to help you navigate that. I want to help you think about what other resources are out there. What else can we tap into? So I don't want to put like that there's a limit, that there's a requirement. There's not. I really just want to meet you where you're at and say, all right, where do we go from here?
Wonderful. Great message. And we will help people get to Karen, or get to their social work in their disease center, or get wherever they need to go if people can reach out. Now we have another question, and folks, please continue to send your questions through the chat or through the Q&A, whichever works best for you on your computer. This is a question really about subspecialists. And again, I'm going to kind of direct this to Carrie, and I'll take a stab at this one too. There are not enough specialists available inside or outside the Dana-Farber system. My oncologist resorts to sending me to the ER for non-urgent things, too expensive and wrong utilization. What can we do? And so I certainly, none of us know the specifics of what's happening in your situation, but I can say that sometimes it's difficult, especially if communication is over patient gateway or over the phone rather than an in-person visit and evaluation, to know what's urgent and what's not. And sometimes doctors, because they don't know, if they don't have access to the acute care clinic that we have available to us at Dana-Farber, which I'll get to in just a second, we don't have access to that because it's the night or the weekend, or it's the end of the business day. We sometimes, because it could be dangerous, we end up sending people to the ER. Now, obviously that's not ideal. And, if that's happening a lot, conversations directly with your doctor about how can we prevent this from happening? What are some of the things that either that you're misinterpreting from what I'm saying, or I'm communicating in a way that you think is urgent? What's going on with our communication? How can we make this better? The other thing that we should know about as patients is that, and this is not part of survivorship, but there's something called the acute care clinic, which is a wonderful clinic staffed by nurse practitioners and PAs for people who are having urgent care issues that need to get evaluated with lab work or to be seen by a clinician, but they don't have an appointment that day with their oncology team. And usually, as all patients at Dana-Farber know, the oncology physician and nurse practitioner PA clinic schedules are packed. There's so many patients that need to be seen. It's hard to squeeze somebody in if they have an urgent need. The acute care clinic lets us do this because these folks come in every morning with an open schedule that is filled up quite quickly, but it's an open schedule for these urgent evaluations for people who need to have, again, lab work, physical exams, sometimes a chest x-ray or some basic ultrasound. non-critical type things, non-ER type things. And this is a great resource that we have. Again, it's best accessed if we're able to contact our physicians earlier in the day rather than late in the day, because the clinic does fill up and then it closes like an urgent care center would. And it's not available on nights and it's not available on weekends. But that is something to maybe think about or talk about. And otherwise, our specialists do try to work people in, depending on the problem, within 3 to 5 business days, which for things that are non-emergent usually is enough. But agreed, it's very difficult to get everybody in a timely way. So let's see, Carrie, from your perspective, any thoughts on this issue of urgent needing to see these subspecialists?
Well, I mean, I think what I'm hearing from people that I talk to all the time is just that just getting into subspecialists in general for everyone is like become really, really challenging. The wait times are significant. And I think that that's a big part of my job, actually, is really figuring out and prioritizing who we need to put at the forefront of our subspecialist lists and who can actually wait a little while. And those are difficult things because I want to honor that whenever you're going through something, it feels like a lot. And for me, I think the most important thing, and I also want to acknowledge the frustration about the ER referrals, because going to an ER today is not like going to an ER 5 years ago. Going to an ER today is like is an invitation for sitting in a waiting room for 24 hours unless you have crushing chest pain. So it really is like a really challenging way to kind of have to be seen. And I've sat in ERs with family members, and as I'm watching it, I'm like, this is a shift in how medical care is happening. So I think it's having to kind of go back and prioritize and triage like what's happening. From our perspective, people involved in our program, that's kind of one of the things I do. And I've listened to a lot of people's frustrations around this. I've also been someone who has tried to help them find resources when there haven't been any other resources. In other words, like we don't actually have the resource at Dana-Farber necessarily to help. And where else out in the world can we get you looped into your care? It takes creativity, it takes patience and persistence, truly, but it is kind of a one-on-one conversation that needs to be had.
Absolutely. And I would also acknowledge that things like orthopedic issues, optho type issues, dermatologic issues, these can be things that are actually a lot more challenging, even for our clinicians here, to get people in. We do not have those services within survivorship. Those are outside of our area of expertise, and so those can be things that you need to be seen urgently, but we don't have the connections. We are trying to build them. At least with dermatology, there is a pager now that teams can use. I think I forget what the first part of it is, but I think the end of it is like For Skin, which is kind of creative. But I think that we're trying to kind of streamline and facilitate, because derm it's needed, but it's hard to get in sometimes. So they've been really responsive and setting that up through their group. Ophthalmologic issues that we're trying to build communications and connections there. I'm still working on that, but hoping to get some stronger connections with Mass Eye and Ear to make sure that is solid and rapid. If your oncologist is still having trouble, they can always reach out to the survivorship program directly. We may have resources or access to things that they're not aware of. And we have had a lot of new nursing staff members, nurse practitioners, physician's assistants, and even physicians joining during the pandemic. And because we're not in person as teams, it can be harder to learn about some of the resources that are available. So certainly sharing with your oncologist that we are available. Your oncologist probably knows, but if they don't, we're available. I'm here to help. Carrie's here to help. We can also facilitate more rapid things, again, especially if they have to do with cardio oncology, endocrinology, which is hormone type stuff, and nephrology, which is kidney stuff. So think about that, share that with your oncologist if you still need help. Now, I have another comment. Keep sending them in, folks. Thanks for offering this webinar. Well, thank you for attending. I am currently receiving treatment, and as a stage 4 cancer patient, I anticipate treatment to continue indefinitely. As I turn 65 this summer, I am faced with deciding whether to sign up for Medicare or whether I should hold on to my private insurance for as long as possible. I've responded well to treatment and know that other treatment options are available down the road, so I perceive myself as a survivor for now and want to make sure I have the very best health insurance going forward. Are there counselors available to discuss insurance matters with me? Thank you. Carrie, can you comment on this? I think this is probably outside of survivorship, but maybe you can comment from your experience as a Dana-Farber employee for many years. What do people do when they have questions about finance?
I mean, I believe what I would do is I would reach out to we do have a whole financial billing kind of department, and I would probably do a little research and try to see if I could find out if there's a person I can connect you to specifically here at Dana-Farber. And then if not, I would probably investigate looking outside, like see if there was someone even outside. Karen, I don't know if you have any information about this yourself.
Yeah, so I do know we have a financial counselors, and I know like Access Management does deal with like insurance, and they probably have more information than I do, like Alicia said, kind of out of scope. But I do know that we do have that department as well as financial counselors available to our patients.
Yeah, and I would just add so I have many patients. I treat mostly prostate cancer patients. So many of my patients are over the age of 65. And so really asking the same sorts of questions, because it can be stressful to go from being on a private insurance to being on Medicare. And so in your disease group, so with your doctor team, your nurse team, and your clinician team, if you ask that question, you could even ask it over Patient Gateway. They can set you up to talk to a financial counselor. And I think that, as Karen said, they're not in survivorship, but they are part of our team at Dana-Farber. And they are really helpful. And even as a doctor who, some may think that doctors have some idea about this question, or there are so many insurances and there are so many different ways that we apply them, and the ways that the healthcare system interfaces with them, and whether you're taking oral medicines or all of it is IV, and how the Medicare Part D comes in. This is all really complex. And so I feel your question very acutely, because I have many patients that feel the same way. But the financial counselors are probably the best folks to try to help manage that gap. And it is a real one. And if you just ask your disease team, I bet they'll connect you. And I'm hopeful that everything will go smoothly. Congratulations and happy birthday in the summer. It's a great birthday to have. So thank you for your question. Now, as we are continuing on here, let's see here. Do either of you have questions or comments that you wanted to just share for the listeners? Are there any things, here's a question, any things that we just talked about finance, like that's not something that we necessarily can deal with in survivorship, though we can help connect you with financial counselors. Are there any things that you're asked about that you say, this is not something that I can help with? I appreciate your question. Let me help you, connect you with over here. Karen, is there anything other than finance? What about people trying to, thinking about trying to get a job after being not working because they were on treatment? Maybe that job's not available anymore. Is that something that you can directly help with?
Yeah, so it's not within my scope, but what I can definitely do is, if a patient is considering going back to work and, kind of contemplating, oh, what do I do? I can always have a conversation, just like a very simple conversation, like, okay, like what are you looking for? Is there anything specific? And kind of there help navigate to whether, it can be a site where you can find jobs, or, maybe I can look up, oh, there's this person who reviews resumes. So that's how I can help. Or even thinking about like applications, like life insurance applications, that's really within, like, out of scope of practice. I'm not, well versed in insurance policies. I wouldn't know much, just because it's not what I'm trained in, or anything of that sort. But I can always help navigate and say, all right, where can I direct you? Do you have any questions? Like if you're looking for different names of life insurance places, I can quickly look like, oh, there's these options, and then provide numbers and say you can call and ask, what they offer. So I'm more than willing to help start the process, but that's really to the extent that I can assist.
Okay, great. And Carrie, are there things that you're asked about that are a bit out of scope for an oncology nurse navigator that you need to sort of help mind the gap, bridge the gap to a different resource?
I think one of the most common things that we're asked in survivorship is has a lot to do with diet and exercise. I think people are pondering kind of what is the way they need to take care of themselves to make sure they're doing the best they can to, prevent recurrence. And I usually refer people to the ZACM Center, which is another resource we have, because we have nutrition counseling there. There's an exercise physiologist there who can really kind of help counsel people where they're at. I sometimes will even refer to people to go, if they're far away, to just go to a local PT for just reconditioning rehab, to just get them started and meet them where they're at. Some people have chronic fatigue from the treatments that they've gone through, and that's a real common question. The other thing I'm kind of passionate about this is the discussions on integrative care. What are some of the things that you can use from that perspective that really help you feel like you're getting some sense of control over your body and you're working towards healing? And so there's lots of discussions. I mean, the ZACM Center does things like therapeutic massage and Reiki. And then oftentimes people have some of their own ideas and they want to talk about them. And I'm pretty well versed in most of those. And then there are also, when people are looking to connect with others that have gone through what they've gone through, I refer people to the American Cancer Society. They have a peer mentoring program. I've reached out to Karen recently. I've got the list of our support groups at Dana-Farber. I have to see if that's a good fit for someone. Live Strong is another program that is focused on exercise that's outside of our bandwidth, but we refer to them regularly. And the other thing that happens too is some people have challenges with lymphedema or specific things because of their cancer. And I have connections to where you go from there. So connecting those people to those important resources, I think, are a lot of the parts of our conversation.
So, and that was a question about what you can't do, and it seems like you can still do it all, Carrie. So that is really good. I think, really the message is that we don't have all the resources within survivorship to meet every need, but that's not going to be possible for any program anywhere. What we try to do is make sure we have an understanding of what resources exist so that we can try to connect people, whether those resources are in Dana-Farber or outside of Dana-Farber, to the treatments, to the care, to the attention that they need. I did place the website for the ZACM Center into the chat. It is a phenomenal resource. It really focuses on diet, exercise, holistic type approaches. Acupuncture, Reiki is such a resource to our patients at Dana-Farber, and even online is a wonderful resource with tons of webinars and content and support and online virtual engagement opportunities. So please do check it out. I think that many people will really benefit from that, and it continues to just build and grow in a wonderful way. So at this point, I think that from what I can tell, you guys are doing phenomenal jobs, and we really are, again, trying to meet patients where they are. We will close this out, I think, by just asking each of you if you have a message for the listeners, whether they're here now in person, whether they watch it in virtual world in the future. Karen, what would your message be to folks who are interested in engaging with social work through the survivorship program?
My first thing is, please do. This is what we're here for. And I think we're all one team. We collaborate with each other, and we're here for you. We understand that these are challenging times, and just in general, but also with your cancer diagnosis, your journey, and it's okay to ask for help. It's okay to say, I need to talk to someone, especially from the mental health profession and this side of things. I want you to know that there's someone here for you, and there's someone who's willing to talk to you, who wants to talk to you as you are. Come with the upsetness, the frustrations. This is what I'm excuse me, this is what I'm here for. See, I got choked up. But this is what we're here for. And we just generally want to help you in whatever way that we can. And, we'll figure it out. Even if we can't or don't have all the answers, we'll figure it out with you, but you're not alone.
That is a great message. You are definitely not alone. And Carrie, what would your message be?
That was really well said, Karen. I would say there's no question that's too small, because I think oftentimes things happen in layers, right? And sometimes when we just explore the top question, the layers start to reveal themselves and how we can support you. I think after having been in college in oncology for over 30 years, I think learning how to manage the mind is one of the most important things that you can learn and grow from in survivorship, because your mind can be a really difficult place once you've been through what you've been through. And if we meet you where you're at, and we help you understand what can help you start doing that, that is a huge game changer in the quality of your life. So no question is too small. Please reach out to us.
Well, thank you both for that. Both wonderfully well said. And I would just acknowledge that survivorship starts from the moment of diagnosis, and your needs are going to change along the way, whether you're in treatment, early after treatment, being treated again, or continuously receiving treatment over time because you're a long-term survivor living with cancer. We are here for you. We may not have the resources within survivorship to address your specific need, but we certainly have an interest and an eagerness to help you find those resources wherever they exist, because we really just want to make sure, as Karen said, that we're here for you. So thank you all for attending, and this will be available and recorded, and I will pass it back to the Blum Center.
Thank you all so much. This was an amazing discussion. I really enjoyed everyone participating so much in the chat and all of your thoughtful responses. As we said before, this recording will be posted on the Blum YouTube playlist in a few weeks, as well as the survivorship website. To access all of our Blum digital resources, you can visit www.dana-farber.org/resource center. And Lauren put the survivorship link in the chat as well, and that will be in the YouTube description. So thank you all so much, and have a great day.